I'm Mark Halperin. Welcome to Wide World of News. We're talking today about a big medical problem facing the United States, not the coronavirus, but another problem that has reared its head in a big way over the last few weeks, which is pain. A lot of Americans, of course, have chronic pain. Some say over 100 million Americans suffer from some form of chronic pain. And it's a difficult problem for those people who suffer to deal with now, confined to their homes, not able to get the physical therapy and other treatment that many people turn to. A lot of people with chronic pain are turning back to drugs, and that is not the best solution for many people because of addiction and other concerns. Our guest today, Dr. Amy Baxter, she's the CEO and Chief Medical Officer of Pain Care Labs, an Atlanta-based company. She's been dealing with the issue of pain for several decades. She's been dealing with that now, but she's also become, as many doctors I know have during the last couple of months, become an expert of sorts on the coronavirus. Very smart ideas there. We'll talk about that as well. But we're going to start by talking about how people in this tough time, while they're largely confined at home, can deal with the pain that they suffer. So tell people about the company you have, Pain Care Labs. Before the pandemic, what did your company do? What kind of people did you help, and what type of person were you servicing in the pre-crisis days?
Yeah, sure. It's been an interesting journey. I practiced pediatric emergency medicine for about 20 years, and my research was always in pain. Because I'm a pediatrician, it was particularly in pediatric and needle pain. So about 15 years ago, I discovered a specific frequency that would block the pain signal. I created a device called Buzzy that was for immunizations for decreasing needle pain, Buzzy. And even though I went on Shark Tank, I was still really just primarily focused on practicing. So I got an NIH grant, we tested it. About 34 million needle procedures later, one of my colleagues had an opioid recovery issue for about 20 years and needed a knee replacement. So at that time, he used the Buzzy device to not take any opioids after surgery. It was about 4 years ago. The opioid crisis was beginning to really explode. And I decided it was probably better to take what we had learned about pain and apply it to opioid reduction to people who had chronic pain, and even getting another NIH grant to go further, looking at this frequency to see what we could do to block pain.
So break that down for me and other people who didn't go to medical school. What does the device actually do to help people?
Sure. So the easiest concept is if you bump your elbow and you rub it, then immediately the pain stops. And what you're doing is you're stimulating one of these mechanical receptors. There's a number of different nerves under the skin that override pain. So light touch, deep touch, motion, position sense, all of them are more important to your brain than pain is. So if you can stimulate, and it turns out in a very narrow band of frequency, you can block pain. So what it looks like is, if you're doing a needle procedure, you take the vibration and put it where the injection is going to go and slide it up, and you desensitize that area by about 80%. And if you wanted to do it for a knee replacement, then you just put that same frequency, that same device into something that can go on your knee, that can go on your shoulder. And one other thing we discovered was if you put in a competing signal, something like ice or heat, you can put those two things together. And so ice and vibration directly on the knee, or proximal if it's from knee surgery, decreases pain about 80%. So I can get into a little more deeply, but the thing that we started realizing was that chronic pain is not what's happening at the site on your body. It's really what's happening inside your brain. So pain is the brain's opinion of how safe you are. And it's not just what you're feeling at the specific level of the skin, it's also what's going on with what that meaning is. It's how much attention you're paying to it. And it's what position your body is in general. So if you're sleepy, if you are irritable, if you are malnourished, all of those things impact pain just as much as how hard or how inflamed an area of your body is.
So you think about the tens of millions, maybe 100 million Americans who have chronic pain, and the stay-at-home orders come in. People talk about obviously not being able to go to doctors for people in the midst of physical therapy or other things. And people have also talked about people who have opioids or other drugs in the house, maybe abusing them. What's your view of how serious a problem those two things and anything else the crisis has caused has been for people with chronic pain?
Yeah, well, ironically, today, April 23rd, we have just about equated the number of deaths in the United States from COVID and the number of deaths in the last year. We have data from opioid overdose from prescription opioids. So about 45,000 deaths a year. Um, I mean, my statistician, the woman I've worked with for 20 years on my NIH projects, actually committed suicide earlier this month because she had chronic pain and tried to get one of our products from us and took medicine before she actually got it. So that's an N of one, that's an anecdotal thing, but what's happening to people across the country is they're used to addressing their pain with massage, with distraction. I like the paradigm of pain, fear, and focus. So there are things you can do to specifically address pain. There's things you can do to focus on something else. And if you have fear and if you're concentrating on what your chronic pain is, that exacerbates it. So this whole Venn diagram of pain, fear, and focus. So the first thing we did when COVID struck was to start trying to address the fear. We had someone that donated a lot of sprays for killing 99% of germs. So with what we normally send out, we started with a pain care package. So we added, first of all, one pain partner gave us the disinfectant that was so hard to get. We had someone else donated small packets of toilet paper. Early in the crisis, it was about the infectivity. As the crisis has gone on, it's much more about giving people options that they can do at home. So we've got a number of different pain partners. I also went through about 50 different evidence-based options. So everything from what supplements help to different physical treatments. All of them are in some mechanism or another stimulating one of these four mechanical receptors to override pain in a way that's non-pharmaceutical. And then finally, mind-body sounds kind of crunchy. I think that we really need to look at pain not as an alternative pain management strategy or as a collateral, but really it's a comprehensive. This isn't about something that is an alternative to pain management. It's that nothing is a silver bullet for pain. So we're trying to provide different options for patients who are at home so that they can keep trying something different. So they've always got an option until the crisis is over.
I'm sorry about the loss of your friend. That's obviously a difficult thing for anybody to deal with, particularly under these circumstances. So very, very sorry to you and the family for that. So just to be clear, you basically shifted in the services you provided to make sure that you were still helping people who couldn't leave the house deal with their pain, but also to try to get them the information and auxiliary products that they would need. What's been the reaction to that from your customers and the people who you help?
The most surprising thing has been that the COVID information is what a lot of our chronic pain patients really want, that the fear of being vulnerable has really outstripped even some of their issues with pain management. So I started doing a Facebook Live 3 times a week at 3 on our Buzzy Helps Facebook channel, just because there were so many questions that were coming in from a physician standpoint. What kind of supplements can I take? And what sort of preventative measures should I use? And how long will this last? Everyone wants to know. So the reaction has been astounding. And some of it has really been things like, I did one where I taught people how to make a mask. This was mid-March, but someone said that they were taking care of their elderly mother and that they themselves were immunocompromised. They were taking medicine for having arthritis. So because their immune system is down, they had no mask, they had nothing to do. So I showed them how to make a mask out of a bra. And I got so much criticism for that from the medical community, because at that point, the mantra was that you had to have an N95, you had to have something that had been tested. And of course, 2 weeks later, it became apparent that any barrier is a good barrier if that's all you've got. So that was one thing that has taken off. But our pain partners have really risen, and now we've got 4 or 5 different types of topical anesthetics. It's a rising tide. Just anything that can be used gives somebody an option and decreases fear.
Yeah, my guess is that for a lot of the people you were reaching and touching, you were the only doctor they had access to at that point, and so they naturally would have a lot of questions, and it's great that you were able to do that. I want to ask you about one other thing, because you live in Atlanta. in Georgia, the state that's now it's so much of the center of the discussion in the country about reopening. I'm just wondering what you think about how the governor's handling it, and what you think that the people of Atlanta, the people of Georgia feel towards the phase we're entering now.
Sure. Well, we've talked about going out and getting tattoos together and then going bowling as a company. But since I put us all in isolation about a month ago, that probably isn't the option. Um, it's a really nuanced answer, and it depends on what we want societally. Because right now, Georgia's 11th. We have tested 0.88% of our population. And while it looks as if the number of cases is going down dramatically over the past 4 days, if you look nationwide, the number of tests is going down dramatically. We're out of reagents, we're out of swabs. So what we want as a society is really what matters. If we go forward with this, we will have a death rate that is about 10 in 100,000 people. And so it's just a matter of, is that the choice that we're going to make? I think that there is something to be said in areas where the population density is that of Sweden. So Sweden's got about 25 people per 100 per kilometer, and there are many counties in Georgia that have that. The thing that correlates the most strongly with the case fatality rate that I have seen is really population density.
Right.
So Atlanta and the Fulton County poverty percentage are a bad mix. We're going to have cases escalate again almost immediately. My hospital, Children's Healthcare of Atlanta, is talking about what we do when those cases go up again. They're actually planning to open elective surgeries May 5th, 6th, not this coming weekend. But one of the things that a lot of people are talking about is that this seems to be an economic decision. If there is no shelter in place law, then anyone who is on unemployment will cease to get the extra $600 a month benefits, and they will cease to be able to draw unemployment from the state coffers. So that's the cynical thing that I'm hearing from most of my colleagues and from people in our community. I don't know of anybody who's planning to go back to work that doesn't have an option to stay home.
Right. Okay. Dr. Amy Baxter, the CEO and Chief Medical Officer of Pain Care Labs, helping people in the country now, both with her core business of helping people deal with pain, but also now, like so many doctors, helping people in other ways dealing with the crisis. Dr. Baxter, thank you so much.
Mark, you're amazing. Thanks for what you're doing. It's really helping.
Thank you. I'm Mark Halperin. Thanks for watching Wide World of News. We'll have more conversations coming up right here. Same bad time, same bad channel. Thanks for watching.